You are the three persons in one. You are the three persons in one. You are the three persons in one. The Spirit and the Bride. You are three persons in one. You are three persons in one. You are the three persons in one. Oh, the Spirit and the Bride. Hi everyone, Dr. Grace here. Good morning. Trying to make sure my face fits into the camera. Good morning. A little noisy here. I'm outside. It's a beautiful morning. Thank God for today. This is the day that the Lord has made. We will rejoice and we'll be glad in it. How is everyone doing? Just checking in. This is Dr. Grace, and you are welcome to my YouTube channel, The Spirit and the Bride. I always like to say who I am, just for you to know my background before anything. So I'm a nurse practitioner with doctorate, and I practice in one of the biggest Los Angeles hospital in the US here, Los Angeles, the city of angels, the Hollywood. That's how it's called, Hollywood. Hollywood. I'm a Niger girl now. Which one, sir? Anyway, I just wanted to check in and see how we're doing, and to tell you that I am struggling with the weight loss. It's not easy. It hasn't been easy. You know, for 40 years, I don't know how old I am, but I know I'm up to 40. For 40 years, at least, that I remember, I have never suffered with losing weight. I didn't know that it's been God's grace, because I exercise like tedious, like miles. I run miles, and this is like my way of life. Every single morning it has to be done. I run miles, right? Even when I'm pregnant, I run. I don't stop running. So I've been skinny all my life. I run miles, and then I eat everything I like to eat. But portion sizes, my portion is very small. My stomach is very small. So I didn't know that it's been God, though, because when I run those miles, I don't feel it. I'm so much filled with energy. I didn't know that God has been helping me. People that struggle with weight, I never knew that it's a real struggle. People say it, but I didn't experience it in my life until now. Now I'm going, is this what people go through to lose weight? I'm like, this is ridiculous. I'm like, no wonder. I mean, I put on a lot of weight when I'm pregnant, but once I have the baby, you know, I'm very patient. I stay up to 1 year. It takes me 1 year to lose the weight. And I do add weight like I added now this is my pregnancy weight. I do add this type of weight. But it takes me 1 year to lose. This weight has been more than 1 year. And it's not moving. I'm not adding more, but it's not moving. It's not encouraging at all. So I wanted to check in on you guys to see how the weight thing is coming on. One goal I think I have achieved is to be healthy. You know, I said in my weight reducing video, you go from, your first target should be to be healthy. No high blood pressure, no diabetes, by God's grace. No, high cholesterol, things like that. So if you are healthy, you should thank God. In as much as the weight is not, doing it, but you're healthy. Go to the hospital, you will see what I mean. There are people that are dying from heart attack. You know what causes heart attack? You know what causes that? We'll talk about heart attack. We're talking about, you know, it can happen from blockages, right? It can happen from high cholesterol, mostly. Vegetarian will tell you also meat, red meat, you know, those things. And then if you have high blood pressure and you have diabetes, so what it does is it causes inflammation in your blood vessels. And when there's inflammation, it leads to, you know, injury, endothelial injury. I don't like to blow this, you know, medical grammar, but when I talk about endothelial, like inside your vessel injury. So when there's injury in your inside your vessel, what happens is that the white blood cells, you know, platelets, everything will go there. Like the neutrophils is the one that arrives first. It will go there trying to repair the injury. So before you know it, it will form a platelet plug. Platelet is what makes you, you know, help you to clot. Like if you have a cut, you know, they will come and will help with the clotting process. There's also clotting process inside your vessel, blood vessels. So when it causes the platelet clog, or like there's a formation of platelet strand, and during, you know, certain things, when your body is not in a very favorable position, like when your blood pressure is going back and forth, it's uncontrolled, today is low, tomorrow is high, or diabetes, your sugar is not controlled. So what will happen is that there will be a reaction that will cause, it will now cause your, that platelet plug to declog. It breaks off, and then it goes to your brain, it clogs your artery, causing stroke. It goes to your heart, it blocks the you know, heart vessels. It causes heart attack. And then it can go down your legs and cause a thrombus also in your legs. And when this thrombus causes like significant blockage, blood flow will become a problem. People get amputation. They'll cut off your your leg, hopefully not your neck. They cut off your, you know, they amputate that part of the leg. They do like an ultrasound to determine which part of your, you know, your vessels in your leg does not have, you know, good blood flow. That's when they cut off people's digits, you know, the toes. Some people end up cutting off some of their toes. Some people become like exactly below the knee amputation. So weight loss is good, but my idea of weight loss is, first of all, is I'm being real. First of all, I started doing, do exercise 3 to 4 times a week, 30 to 40 minutes for your heart, for your whole well-being. Taking a walk alone will, you know, do some work on your bone density. So you hardly have, when you get older, you're not going to have osteoporosis just by walking. It's called weight-bearing exercise. You're walking, you know, taking a walk helps. And so my goal is, first of all, achieve good health. From achieving good health, becoming fit. Remember we talked about making sure you are on different and you know, supplements, all kinds of supplements to assist you. And then exercise like the Heart Association recommended, like I told you. Be active. And then once you've achieved that, you go to the doctor. The doctor does physical. You have to do your physical every year. Check everything. If you're a woman, they will normally, let me tell you what to, you know, they will have to run. If they don't run it, you need to ask the doctor. Have them check complete blood count. Another one you will check CBC, that is complete blood count. Then you do comprehensive panel, and we call that CMP, comprehensive metabolic panel. That will check all your electrolytes, that will check your liver, that will check your kidneys, that will check pretty much levels of like magnesium is good for the heart, so you don't have heart arrhythmias, like your heart not beating regular. And you check your potassium, is also very helpful in conduction of the heart. So these electrolytes are very good. And there are ones that are good for the gut. They got it for the gut, like health. This probiotic is good for your gut. People have colon cancer and all that. So then another blood test that you have them do, A1C to check for diabetes, okay? And then lipid panel to check your cholesterol. And then vitamin D levels, like I'm in the sun, I'm getting my vitamin D. Most adults have low vitamin D. Low vitamin D has been attributed to all kinds of things. Heart attack is good for the heart. And when COVID came, low vitamin D was found to contribute to people not doing well. So, and then you will have them check, there's one more, check like your thyroid. Your thyroid is very important. So these are the, when they've checked all this, am I missing anything? What else? I think these are the basic comprehensive list of what should be done when you go for your physical. So normally your doctor will have you fast for this some of these tests. You have call the doctor and have them call in these labs for you. You go do the labs before you come for your physical, so that it will save you time. It will save you time. Just if you don't have that good relationship with your doctor's office, I really suggest you look for a better doctor. You should have a doctor, good doctor rapport with your doctor's office. They should be able to do it for you. So you go do your labs, and then you show up, and by then the result is out. You have only one visit to make. The doctor will go over the results with you, and then he will check your body out. He will do a complete body assessment. Also for women. For men that is now 45 and above, you have to go to colonoscopy to check out your colon, the large intestine, or they can do what they call occult blood. Occult blood is like a stool sample, but you can do that yearly, also to check out for colon cancer. But that occult blood, the specificity is not, it has I think they said it has about 80 something percent being correct. So there are chances of still missing some colon cancer with that blood, the stool work. So it's better you go for colonoscopy. And the way they do colonoscopy now, normally the preparation is what makes people not to want to go, but the preparation now is very easy. It's not as tedious as it used to be. COVID changed a lot of things. We got wiser. So, and that's it for men. Also, you have your doctor check your PSA. What's the full meaning? Prostate specific antigen. Yes. PSA checks for potential prostate cancer. So if you're also a male, once you get to 40, you should be doing that. If you have history of colon cancer in your family or prostate cancer, you should get those things done earlier than 45 years. Now for the women, additionally, you have to do your mammogram. Once you turn 40, you have to have a baseline. If you have history in your family, it should be done before 40. And then the pap smear for the women, it has to be done. And once it's normal, they have some, the age, specificity that has to do with it. Some people will now start going after you do every 3 years, and some will be every 2 years. I can't go into that details. It's not something you memorize, but there's a place it's laid down. We follow that rules. If you're in the clinic, if you're a clinic doctor, I'm a hospital doctor, but I've done clinic in the past. So, but your doctor's office will know, what, your OBGYN, the GYN will tell you based on your age how often to do the pap smear. Okay? And basically, that will do it. Of course, for women, sorry about the noise. For the women, they will have you, of course, submit your urine. I think for both people, for both species, both genders, male and female, you do urine test. The urine can test all kinds of things, mostly to check protein in your urine. If you have protein in your urine, it can also start suggesting some kidney issues, which protein is not good to have in your urine. Some people have blood in the urine. If you are 40 and over, you should make sure it's taken care of, because microscopic hematuria, which is blood, microscopic blood in the urine, you don't see it with your eyes. Sometimes it can also be a sign of prostate, some kind of cancer. Prostate cancer is normally gross hematuria. Gross hematuria is like you'll be peeing blood. But if they find it early, it can start from microscopic blood in the urine. So all these things are things, if you're in Nigeria, if you copy these things down, go to the lab, they know about all the tests that I have said here, and they will take care of it. If you are watching this, you want to message me. If you go for your testing in the lab in Nigeria, message me in this YouTube. Tell me you can get the result if you scan it and or take picture of it and send to me. I will interpret the results for you. If you go under Facebook, I'm under NK Mekus Solutions with an S. That's my Facebook address, or in this video you have the Facebook address. You can do that messenger thing and I will reply. If you send the result there, I will type and explain. I will even make a voicemail and send to you so that you know the interpretation. I have people reach out to me, people that have done like some cancer markers, like hormonal stuff. That's not my specialty, but if you have history of cancer in your family, it's advisable that you do some hormonal things, hormone specific cancer labs. Like me, I have history of breast cancer in my family, so I actually was the Holy Ghost that alerted me. He said to go for that BRC 1 and 2, the hormonal specific cancer markers, because I have a history and I've gone for it, and thank God it turned out well. Same thing, if you have colon cancer history, there are specific lab tests to test for that. Aside from what we discussed, the one I just told you here is general. If you don't have a history, just doing general checkup. But if you have history, of course, tell your doctor. He will order more specific ones. Also for like other like GU, genitourinary system, we're talking about bladder cancer. If you have such history, please go see your doctor for specific labs. Also for other female organs, like there are other female things that can come out. people that have endometriosis, people that have dry, dryness in the vagina. Once you turn 50 and above, you start experiencing all these things. But there, you can avoid them, by doing certain things ahead of time before it even comes, so that you don't experience these things. There are things to be done. People that have vaginal dryness, when I was working outpatient, so many of them will come to me. Vaginal dryness is a problem. That will give you painful sex. You will no longer enjoy sex. This comes with age. But to, avert some of these things, there are things to be done. There are things you can do. And it's all about stimulation of that area. The juicy thing is not stimulated as it should anymore. And that's why you end up with dryness. This dryness is even when you use the gel, it doesn't help. It's just that the hormone that is responsible for this thing is low. They call it estrogen. So some people here, they do hormonal replacement, but hormonal replacement comes with a lot of disadvantage and things that can happen. One of the things that scares me is that stroke. The possibility of getting blood clots with hormonal treatment is very high. Yes, you'll be enjoying sex, but the risk of stroke is very high when you do those therapies. So, but if you know these things, why don't you go ahead of time, ask your GYN on what to do to avoid, if it's possible, you may be lucky and avoid it. It doesn't happen to every woman. And me, I'm a Christian. I believe that it shouldn't happen to me. So there are things I'm beginning to do at this age to prevent me from getting there, by His grace, because I don't know, that's not a good place to be. Not for me. I reject it. Not for me. But medical wise, you have to do what you have to do. So anyways, I didn't know this video was going to be strictly medical. We hardly go strictly medical, but today we decided to go strictly medical. I didn't know. All the things I said here was not planned. I didn't know we're gonna say this. All I came in was to check on you and see how you're doing, and see people that are interested in losing weight with me, see where you're at. And this whole thing started coming out. This is what I do for a living. It's not crammed, it's not memorized. You just know them because that's what you do for a living. Although I'm not an outpatient doctor right now, I'm inside the hospital. This, what I discuss here, is preventative medicine. But somehow God led me into doing it. Also, maybe some other day we'll discuss about your children. There are things that you should be done, especially when they turn 18 and above, they're entering adult stage. They should have their blood pressure checked when they go for physical, and they will start running their tests, the labs that I discussed at that age. Some of them, a lot of them, yes. But most importantly, for the female, from 21, they'll start doing, they check them for, forgotten, what am I thinking? But they check them for, there's this cancer, type of cancer, I'm sure you know what I'm talking about, that is rampant at that age. So they can start their pap smear. For boys, they do testicular examination. If you have a boy, when you go to the doctor, make sure they're touching the testis. You're not going to be there, but the doctor should do it. Make sure the doctor does these things once a year because of testicular cancer, because it's very high in the young people, early 20s. So I'm going to stop this video. Thanks for watching. Please subscribe. Most importantly, please share the videos. I don't come here to give you a lot of things in the internet. There's so many information, but one thing I want to tell you is that nobody edits this information. So it could be, if you are not in medical field, when I go to the internet, I screen things that I read. I kind of know what makes sense and what doesn't make sense. But you're not in medical field. You're not gonna internalize everything in the internet as if they are true. Nobody edits the internet. Everybody put all kinds of junk, and we have good things from the internet. Don't misunderstand me. But that is why you have channels like my channel that will bring you things not just from the internet, because we know you can read it there, but we'll screen it and bring you, something that is true and something that we do every day, that we know that this is gold standard measures that should help you. Okay, also I bring you holistic care. I discuss both your medical care and your spiritual care. Everything about health should be both medical and spiritual. Mental health is very important, and then the medical aspect of it is very important, and that's what we discuss in this channel. Thanks for watching. I will continue the girl child in Kali whenever the spirit prompts me to continue. We stop that video at volume 3, but it's gonna keep going. I don't know how many volumes it will be. So thanks for watching. Bye bye.